Hi everyone, welcome back to my channel. Please like, subscribe, follow, comment, share, and do not forget to drop your question in the comment section below. And to my followers, really appreciate you. God bless you and keep you. For those not following, please remember to follow your will bless. So today I've come again for those battling with vaginal yeast infection. I'm telling you how bad yeast infection can be. Vaginal yeast infection is a fungal infection that causes irritation, discharge, and intense itching of the vagina and the vulva. This infection is also called vaginal candidiasis. Vaginal yeast infection affects up to 3 out of 4 women at some point in their lifetimes. Many women experience at least 2 episodes. Vaginal yeast infection isn't considered a sexually transmitted infection, but there is an increased risk of vaginal yeast infection at the time of which regular sex activities. There's also some evidence that some infections may be likened to oral sex. Medications can effectively treat vaginal yeast infection. If you have recurrent yeast infection, you may need a longer treatment. So I'll be telling you about the symptoms of yeast infections. Uh, Yeast infection symptoms can always range from mild to moderate, and this include one, itching and irritation in the vagina and the vulva. Two, a burning sensation, especially during intercourse or while urinating. Another one is redness and swelling of the vulva. Number four is vaginal pain and soreness. Number five is vaginal rash. Another one is watery vaginal discharge. I need you to note something that you might have a complicated yeast infection if you have severe signs and symptoms such as extensive redness, swelling, and itching that leads to tears or cracks. Another thing is you have 4 or more yeast infection in a year. Another one is your infection is caused by a less typical or type of fungi. Another one is if you are pregnant. Another thing is you have uncontrolled diabetes. Your immune system is weakened because of a certain medication or condition, such as HIV infection. Another one is that I will be telling you is what causes vaginal yeast infection. You might not know what actually causes vaginal yeast infection, but there are so many things that causes vaginal yeast infections. So number one is there's one called fungus candida albicans is responsible for most vaginal yeast infection. Another one is your vagina naturally contains a balanced mix of yeast, including candida and bacteria. Certain bacteria act to prevent an overgrowth of yeast. An overgrowth of yeast can result from one, antibiotic use, which causes an imbalance in natural vaginal flora. It can result to pregnancy. Another one is uncontrolled diabetes. Another thing is an impaired immune system. Another one is taking oral contraceptives or hormone therapy that increases estrogen levels. Another one is Candida albicans is the most common type of fungus to cause yeast infection. Yeast infection caused by other types of Candida fungus can be more difficult to treat and generally need more aggressive therapies. Now, there are some factors that increase your risk of developing a yeast infection. There are some certain factors that increase your risk of developing a yeast infection, and these factors include antibiotic use. Antibiotic use. Yeast infection are common in women who take antibiotics. Broad spectrum antibiotics, which kill a range of bacteria, also kill healthy bacteria in the vagina, leading to overgrowth of yeast. Another one is increased estrogen levels. Yeast infection are common in women with their higher estrogen levels, such as pregnant women or women taking high dose estrogen birth control pills or estrogen hormone therapy. Another one is uncontrolled diabetes. Women with poorly controlled blood sugar are at greater risk of yeast infection than women with well controlled blood sugar. So let me take you through the journey of the prevention, how you can prevent a yeast infection. If you want to reduce your risk of vaginal yeast infection, wear underwear that has a cotton crotch and doesn't fit too tightly. It might also help to avoid tightening fitting pantyhose, douching, which removes some of the normal bacteria in the vagina that protects you from infection. Scented feminine products, including bubble baths, pads, and tampons, hot tubes, and very hot baths. Unnecessary antibiotic use, such as for colds or other viral infections. So all this can help you prevent yeast infection. Staying in wet clothes such as swimsuits and workout attire for long period of time. These are some ways to prevent vaginal yeast infection. So how can you be treated for this infection? Antifungal medications treat most vaginal yeast infection. The specific medication depends on the severity of the infection. Your healthcare provider will prescribe the best treatment based on your symptoms and condition. Antifungal medication work by fighting yeast overgrowth in your body. Medications are either oral which is usually given in one dose of fluconazole by mouth, or topical, used daily for up to 7 days. You may apply topical medications to your vaginal area or place them inside your vagina, that is, the suppository, using an applicator. Some common antifungal medications are meconazole and teconazole. The healthcare provider will give you information about each form of medication and direction on how to use each one properly. And it's also important to always follow your provider's instruction when using this medication to make sure that the infection is fully resolved and doesn't return. If you're taking medication for a yeast infection, you shouldn't have sex until you have finished treatment. Sex can cause more irritation, and certain antifungal medication can weaken the materials used in condoms. Health is wealth. Do not joke with your health. I'll see you in my next video. Please subscribe, follow, like, and comment. Bye.